Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, we're talking with Manish Shah, the co-founder and CEO at PeerWell. How are you today?
I'm doing well. Thanks for having me.
Absolutely. I'm excited for us to touch base. We talked the other day, we were able to go through some stuff, and now it's exciting to finally be recording and talking some more. I'd love if we could kick things off by you giving you a little bit of a background on yourself, and then we'll talk more about PeerWell.
Yeah, I'd love to. So my background has been building, investing, or advising companies for close to 20 years, all based out of the Bay Area. Prior to PeerWell, I was a co-founder of a data business called LiveRamp, which, come to think of it, has actually informed a lot of what I wanted to do and bring into healthcare with PeerWell.
So now your baby right now, right, is PeerWell. Can you talk us through? I like to focus on three things: the why, how, what of the business, and we can talk more about the problem, I guess, in depth, and then some of the ways you're solving it.
Yeah. So the question around why, I mean, it's multi-dimensional, I'd say. So kind of the experience that I had at LiveRamp, where, a data business that was enabling large and small companies to kind of leverage their own internal data to make better decisions about how they communicate to customers. And we saw this kind of paradigm shift happen like right in front of us, where businesses were moving from kind of an analog style of communication, think about like Mad Men style billboards and magazine ads, to an information-driven paradigm where they're looking at data to figure out where should they be messaging to reach their existing customers and prospective customers. And so we built a lot of enabling technologies at LiveRamp to make that paradigm shift happen much faster. And I saw a similar thing happening in healthcare, where we're moving from an analog style of healthcare delivery to an information-driven model, where we're kind of using data about patients to understand in real time what's happening to them, their physical status, and then using that information to then intervene or proactively get in front of those conditions, so that the patient's not having to show up at a ER, emergency room, or urgent care center, or clinic waiting to get cared for. We can actually do things in advance. And so I saw that kind of story unfolding in healthcare and thought I could leverage a lot of the earned wisdom from LiveRamp into the healthcare experience. So that's kind of like the first step that brought me into healthcare. And then, as I was learning about this behemoth of an industry, it's, multi-trillion dollars of spend happening year over year in the US. But when you start to get into it, there's different components, different nooks and crannies where you can have a lot of impact. And so, I saw it firsthand with my dad when he went through a knee replacement inside of Kaiser, and just saw how even at, what's known to be one of the best institutions in the world at delivering integrated care, just a lot of things going missed. And I saw an opportunity to say, hey, there's actually a big opportunity to improve the lives of people going through musculoskeletal conditions.
Can you talk? So you gave us, that was a great why, how, what, by the way. The passion too comes right. I can tell when people who are listening, go watch the video too, because you can see how excited you get when you're talking about it. There's a smile when you're talking the whole time. And that's my favorite part about doing these like face-to-face, like through Zoom call podcasts, is I get to actually see how excited you are about what you're building and why it's important to you. So that's my two cents on it. You gave us within that why, you talked a little bit about the problem. Can you dive? First thing, when people go to your website, right, they see your problem kind of laid out in 4 boxes. Can you talk a little bit more about why this is a big problem? And then we'll tie that into, which you did a little bit already, but I want to talk more about these 360-degree care pathways that is basically part of your solution.
Yeah. So, I mean, for those that are less familiar with musculoskeletal, it's a gigantic category of spend in healthcare. I think a recent JAMA article came out that looked at all the top disease categories as far as spend goes. And musculoskeletal is at the top. It's actually so far at the top that they had to split it into two categories. There's one for lower back pain alone, and then another for other musculoskeletal. So it's like literally the top 1 and 3 categories of spend in US healthcare. I think the current estimates are about $200+ billion in spending year over year in musculoskeletal, and that's across a range of treatments and diagnoses and things. About 130 million people affected per year. So literally at any point in time, 1 in 2 people is dealing with a musculoskeletal issue of some kind, right? So that's back pain, neck pain, having a knee replacement from end-stage osteoarthritis. There's injury from playing sports or doing other things. So it's kind of a part of our lives, right? As long as people are upright and moving, they're going to be having issues with pain and immobility, and that's kind of forgotten, I guess, in some ways in healthcare. We tend to gravitate to these other disease conditions like diabetes or cancer, but musculoskeletal is just kind of like part of being alive, and so it's a massive category that needs attention.
Thank you for providing more about the problem. Can we segue from there into, by the way, beautiful website. It was great to be able to do research about the company, and super easy to digest format. Whoever set it up, great job. Can we talk more about where you see, I guess, to the future of this industry heading? So let's put the lens on it from your point of view. And then also, your company, PeerWell's place in the future of this space.
Yeah. So, when we kind of have a different perspective of what helps a patient struggling with pain and immobility, right? And when you really break down, even going into the problem statement about where all this hundreds of billions of dollars is being spent, it's on diagnostics and surgery and opioids and treatments like physical therapy and a lot of things, right? So big expanse of treatments and therapies that are offered to patients dealing with pain and immobility. When we kind of look at it from the patient's perspective, it's not actually like it shouldn't be treated as like a grab bag of things that's going to help a person overcome this issue that they're dealing with. And oftentimes in the traditional healthcare system, we tend to isolate to one particular thing that might be treatable, but it's not actually solving the problem for a patient. So for example, a lot of patients with back pain, for example, are recommended to go to physical therapy because that might help with their pain, but it might also help avoid unnecessary surgery and whatnot. But then it gets kind of forgotten that this patient is also dealing with poor nutrition, and that's causing high BMI and high blood sugar. And that actually is an impediment to their recovery on physical therapy, because if they're not taking care of their nutrition, if their weight is not managed in addition to their physical therapy, no amount of physical therapy is actually going to help that person, right? They're still carrying excess weight on their joints that's going to cause pain. Also, somebody who's struggling with chronic depression isn't going to get better by just giving them more physical therapy or even making it telephysical therapy so they can do it from home. It's the chronic depression that's keeping them immobile, that's stopping them from actually achieving a full and effective recovery. So this kind of goes into our thesis behind whole person care for supporting people with pain and immobility. So in all of our programs, we try to leverage what we call our 5 pillars of health optimization to ensure patients are getting a full, comprehensive analysis of what's going to help them with their issues. So we cover physical therapy, nutrition counseling, pain and mental well-being, health literacy, and the quality of their home environment, because all of those things play a role in whether or not this patient is going to actually get to full and healthy life.
Yeah, it's. I don't think this was a problem when I was researching, and then obviously after talking with you, it makes sense that I think in healthcare we often focus on like you were mentioning, certain areas, and then it's not that we neglect the other areas, but we don't put the spotlight as much on them, even though they're very important, right? Especially the area you're going after, where it's much more common for someone that's going to have the issues that you're trying to help solve than some of these other areas within healthcare. What are you, quickly, one last thing before we kind of segment away, what are you really excited about in terms of PeerWell moving forward?
I mean, I think that we're kind of entering a whole new era of how we can deliver care to patients that uses all the technologies that we've now grown accustomed to actually make care more efficient and effective for patients, and reduce a lot of the kind of unnecessary burden that people have to go through to actually get better, right? So not having to go to a clinic twice a week to get, you know, an ice pack put on by some physical therapy assistant and call that healthcare, you know? Instead, patients can use kind of the devices they already own, like their everyday smartphone, and get in real time an understanding of their range of motion for their knee that's hurting, right? And then how does that data inform where their care plan goes from there, right? Can that happen in real time? Yes, it's possible to do this today, right? If your range of motion isn't recovering in 2 weeks, based on what you're going through, you can immediately change tactic and say, like, hey, this is not progressing as it should be. Let's do something about it, right? And that data can easily be communicated to the patient, communicated to their care team, whether that's their orthopedic surgeon or physical therapist or both. They can now all be on the same page about what's needed, and then we can very quickly change tactic to make sure patients are getting the most effective treatment in real time.
Well, it'll certainly be exciting to see you and your team continue to build this company out. Just so the audience knows, this is really your intro podcast. I hope to have you on again very soon, where we can kind of we could dive more into some of these issues. At some point too, like any partnerships that you form, it'd be great to have a kind of group collaborative podcast where we're talking about how you're working together as well. The possibilities are endless, right? So yeah. I'm excited that we connected, and thank you so much for coming on the podcast.
Oh, likewise. This is great.